My name is Steve Gardner. I'm the Managing Director of Healthcare World, and I'll be chairing our session today, our breakout session on market entry into Dubai and the Middle East. I've got a fantastic panel who I'm going to ask to introduce themselves. We'll start with Niti Paul, who today gets to be a panelist instead of a chair for the first time. Niti, introduce yourself.
Thank you, Steve. I'm glad not to be chair, and it's your job today. I'm Dr. Niti Paul. I'm a family physician by trade. In the UK, in inner city Birmingham for over 35 years. I work internationally with three hats. I work with AXA as a senior digital health advisor for their emerging customer business in about 8 countries. I work with KPMG as their medical director of their global healthcare practice, focusing mostly on government advisory, and I'm board chair for Harbour, a health technology accelerator in the UK. And I work in the Middle East. I'm working currently in the Middle East extensively, mostly in Dubai and in KSA.
I've always wanted to ask this, Niti. What do you do in your spare time?
Ooh, I garden.
I'm amazed you have any. Vincent, over to you. Give us a quick introduction.
Hi, everybody. I'm Vincent Buscemi. I'm a commercial healthcare partner and the head of independent health and social care at Bevan Britton. We have been assisting clients to export their goods and services into markets in the Middle East for about 12 years now, and we have quite a good deal of experience in assisting not only traditional providers of services, but also medtech, life science organizations looking to enter into the market. So it's a pleasure to be here with you all today, and thank you, Steve, for inviting me.
No problem. It's great, actually. One of the things I love about this is the fact that we're able, in this virtual world, to bring people together from all over the world on the same panel, which means that we have a couple of fantastic representatives from the region itself. From Dubai Science Park, we're very honoured to have Marwan. Marwan, introduce yourself, please.
Hi, I'm Marwan Abdulaziz. I'm the Managing Director of Dubai Science Park, which is a community for companies in the areas of science of all sizes, from large to small. I also have another hat with the Dubai government, and I advise on the pharma manufacturing side under the Dubai Industrial Strategy 2030.
Thanks very much, Marwan. And finally, Mazen Gadir, who also has a couple of hats. Mazen, do you want to introduce yourself?
Absolutely. Thank you so much. I'm basically the quantum physicist in the room. I've been in this region for almost 42 years. I come from an electrical background. I've been in the digital health space for almost 21 years. Currently, I serve as the IQVIA Africa, Middle East, and South Asia Director of Partnerships, covering over 57 countries. Previously, I wore multiple hats and still, until today, worked at PricewaterhouseCoopers Consulting in the advisory role, as well as in Cerner, doing digital health transformation across the region, started in the UK. Spent 13 years of my life in the UK, 3 of them in the NHS, doing the national program for IT. Currently, I also do a bit of advisory board roles in the academic world, and for Project Management Institute, for example, trying to extend the excitement of digital health across the region. So thank you for having me in this wonderful panel of scholars.
I always feel like, Mazen, I should extend the same question to you as to what you do in your spare time. How you guys manage to combine so many roles, I'll never know.
I have 2 things, 7-year-old and a 4-year-old, that keep me very honest and busy at home. So.
I know how that one works. I know how that one works very well. So the format today is a very, very simple Q&A. We're lucky enough to have a number of our virtual trade mission attendees on the call with us, who will be posing questions throughout. To those on the call, please press the hand up button if you want to ask a question, or just wave at me. I can see you all. We're also joined on the live stream on the main Healthcare World Festival website by, I think, about 500 of you. Please, those watching, don't be shy. Put your questions to the panel in the chat. I'm going to kick off with a kind of start of a 10, if you like. The Middle East clearly is a region of the world that offers huge opportunity. UK companies and companies from around the world in terms of its healthcare development. I want to ask you each in turn, panel, where do you see the main opportunities in healthcare? Where are the big growth areas, and what should companies looking to enter the region be thinking about when they think about healthcare in the Middle East? Nitty, I'll go to you first. In fact, I'll go in the same order we did the intros. Nitty?
Yeah, sure. So things to think about is local healthcare systems and what's occupying them. So I think sometimes solutions that come in from another country it's not always a plug and play, right? So really understanding the market and understanding where you're going and what the local healthcare system looks like, I think is really important. Particularly in the Middle East, you see, because there is the private sector, obviously, a very vibrant, very thriving private sector, but you also have the public sector. And the public sector has universal healthcare in place. They contract with private providers to do what they need to do in places like the UAE, but also in the Kingdom of Saudi Arabia, where the public sector is very vibrant, and a lot of change is happening in the Kingdom of Saudi Arabia. Many ACOs or integrated care systems are being set up and down the country. So lots of need for something to support the public sector as well. So I guess what I'm saying is you want to enter the Middle East, think very carefully about that interplay between private and public, and really start to understand the mechanics of how things work in countries before you decide your solution is good enough to take there. And it's just like, it's great in the UK NHS, but it may not be the right fit for something in the Middle East, or there's lots of great people on the panel here who could help you understand that and navigate that minefield. Does that answer your question, Steve?
That's a perfect segue actually into one of the people that can help you navigate the minefield. Vincent.
Thank you, Steve. I think in terms of the conversations I have both with colleagues on the ground in the Middle East, as well as clients on this side looking to enter, I think there's a combination of factors really that are driving some of the growth in demand, and many of the same sort of challenges that we have here in the UK around aging populations, increasing life expectancy, lifestyle choices, and some of the sort of diseases that go along with that, together with a sort of focus on prevention and well-being rather than simply responding to a sort of sickness model and providing treatment. All of that, I guess, as a package is leading to a range of opportunities, not only for new models of care and out of hospital services, something which providers and system operators in the UK have experience of and have been grappling with, and can bring some of that skill sets to bear in discussions. But also, I think it goes wider than that. I think there's workforce issues, because often there may be shortages of necessary clinical or other skilled staff. There's sometimes a reliance on expats, but through training and supporting people on the ground, and many of our clients are actually doing that by skills transfer and upskilling in-country individuals. You can help to create, gives you a different offering. And I think, of course, as we've seen over the last 12 months or more, the drive to do things differently through digitization, digital health, remote consultation and remote monitoring, AI, all of that sort of med tech side of things, which the UK is highly experienced at, and has lots of good entrepreneurial startups and scale up companies. Those are good opportunities as well. And I think ultimately, whether you come from the public sector here in the UK, the NHS, or whether you're an independent or private sector provider coming from the face-to-face patient side of things or within the supply chain, there are good opportunities to work in partnership with colleagues in the Middle East, whether those colleagues come from the private or the public sector, as Niti said.
Thanks, Vincent. Marwan, you're there on the ground in Dubai. What do you see as the big kind of need areas in healthcare?
I see them really in two stretches, if you will. If you look at the right side, I would call it the more specialized, complicated things like oncology treatment, for example, creating centers of excellence in cardiology, etc. There is a lot of that is really heavy on the knowledge transfer and on not only on the technology side. I think we have the best hospitals, the best machinery, the best equipments, but not necessarily the right people to make that work. So one side of it, I think, is that, I think the elderly care as well is a big part of it as well, with people aging and getting older, which was never a problem here in the GCC. And then on the other side, I think you have the other extreme, if you go to the left, is on the wellness. So how do we keep people going to the hospital for unnecessary reasons? How do we maintain a good lifestyle, getting kids be active, families, and really taking advantage of all the information that has been generated from the insurance. So the insurance in our region is fairly new, probably 10 or maybe 15 years old, and there has been a lot of information that has been collected during those years, but we haven't really taken that information and used it for, better analysis, making better decisions. So I think from my perspective, I look at it at two extremes. One is the very specialized care that comes with a lot of talent and requirement for specialized workforce, which creates opportunities for training and upskilling some sort of knowledge base. And then on the other hand, you have the whole patient experience, telemedicine, teleconsultation, telepathology. That's another great area.
So that's a fantastic tracing, I think, of the needs and the requirements, and some topics I think we'll come back to a little bit later. Mazen, how do you see the needs of the region?
Having actually worked for Dubai Health Authority for almost 3.5 years at a critical stage where Dubai Health Strategy came out in 2016 to 2019, and also being exposed to what's happening, for example, in Abu Dhabi, Saudi Arabia, Qatar, and the region, definitely value-based care and the transformation into value-driven healthcare, as mentioned by Dr. Aniti, the concepts of ACOs, reimbursement, shared risk, the concepts of shared risks and contracts between payers, providers, and regulators, or payer providers and employers. That's number one. I think I see a lot of drive towards there. Post-COVID, obviously, or post-pandemic, we have a lot of drive towards resilience, and resilience generates questions on who pays for treatments, who pays for that. So there's a lot of transformation towards the universal health coverage concepts across the region, from Egypt to India to West Africa to South Africa, where the universal health coverage has become the trend of the region in the most recent months. Number three is basically what I wanted to allude to is the supply chain. People want to localize supply chain when it comes to healthcare. You want to actually build capabilities for production, capabilities and competencies for workforce. No longer do we bring nurses from east to west or west to east. Now everybody has to work on localizing, building competencies, building supply chain and procurement capabilities, managing their, even in Africa, as soon as India shut down because of the outshoot or the outbreak of COVID recently, Africa's supply of vaccines got impacted immediately. The recent forums that has been happening are about securing local supplies of producing locally supplies of vaccines. So these are three major trends that I see: value-based care, localization of supply chain, and procurement capabilities, as well as workforce. And then the third one is basically the the universal health coverage and the reimbursement revolution that happens in countries like Egypt, Saudi Arabia, Qatar, UAE, and whatnot.
Again, fascinating, and just gives you an idea of kind of the depth of the topic that we're covering here. What I'd like to get into next, I think, is the practicalities of how UK or companies from around the world can enter the market. And Marwan, I want to come to you first, because obviously, as Dubai Science Park, you are an organisation that can help people and can help organisations to get set up in the region. How do you do that? Do you want to explain that for us?
Sure. So the way we do it is that we basically do two things. I want you to probably think of it as hardware and software. On the hardware side, we basically invest in infrastructure that is fit for companies. So, and we look at the value chain from R&D to manufacturing to distribution and storage. And you end with offices for marketing. So we've asked ourselves, we want to be able to help companies throughout their journey from the beginning till the end. And this is how we built our park around it, from having a light industrial area to laboratories to offices to co-working space. So we've made sure that we're able to help companies wherever they are in their journey. It's been an investment of around $500 million. So it's a very, very serious long-term investment, done by the Dubai government. On the software side, on the software side, we also realized that we should be doing a lot of hand-holding to new companies that are new to the region. So we take an active part in introducing them to other companies who might be able to help them, or to companies that they could do a joint venture with, for example, whether it's like a local manufacturer or someone who has testing capabilities. We're very big on that, and we also get involved with discussions with regulators if, for example, the technology they want to bring in is not licensed or there are no guidelines for example. And also, we would connect them to investors if needed. We don't do the investments ourselves, but we work with other private equity and venture capital companies who have the appetite to invest in smaller companies. So that's in a nutshell really what we do, and I'm proud to say that this kind of work has resulted in more than 400 companies being part of the Dubai Science Park.
Wow, that's an impressive number. And just to sort of round out on that, because I'm sure people watching will want to know, how do they get in touch with you guys? Is it through your website? Is there a particular route you like people to take in terms of contacting you?
Yes, I mean, website is usually the best way, because it has already some good information, and then there is a link where you can speak to someone. And I'm happy to leave my email address as well. It's usually very much case-to-case basis. It depends on what the company wants, which area are they in, but we, in a nutshell, that's what we do.
Great stuff. Thanks, Marwan. I can see Nitty with her hand up. Nitty, do you want to come in?
Yeah, sure. And I think that's such a great segue, Marwan, and you've done such a great job of this in Dubai. And not many countries have managed to do this so well. So it's a really great place to be. I mean, it's a thriving community, right? So from my perspective, at Harbour, what we do, Steve, is also help companies, because we're a technology accelerator incubator. I probably screen between 50 to 100 startups or companies, pre-Series A, Series A, startups that want to get to places like the Middle East, but not just the Middle East, of course. We work with many others. I think what we have to do, and we end up doing, is what I said right at the beginning, is looking at the product, localizing it, making sure it's in the right state to be taken somewhere else, and the business development side of that. So how do you do the BD? So it's all very well. So you have a tech tech company that does great things like value-based care that Mazen was talking about, can do the population health analytics, can churn out the data at the end of this. But then how do you localize that to the country you need to get into, and how do you generate the revenue? How does it become commercialized is what we do at Harbour. So really start to look at what the commercial things might be in the country that you're trying to get into, and then try to introduce folks like Mazen has said, like Marwan was talking about, is to try and introduce them to the right docking stations. By docking stations, I mean, the right providers who might be able to take them, the right distributors who might be able to take them to market, and then really, and also I think the government is the biggest distributor of healthcare in most countries if universal healthcare is going to be realized, really making those introductions and making the right ones so that you don't end up having misfits and people get disappointed with that. So that's kind of what we do in Harbour, and really happy for people to reach out on my email as well, Steve, if people are interested in talking to us. We also have a big network like you have, Marwan, of investors, both in the Middle East, but also in London and other places, both family offices as well as VCs and private equity guys who are interested in hearing about some of these things.
Perfect. I was taking notes, Niti, about Harbour, so I'm going to get in touch with you directly and we'll have a deeper chat.
That'd be great. Thank you.
Yeah, it's one of the reasons why Harbour is one of our key partners. I think is actually that level of support that they can offer. I think there's a really good point that Niti makes there, though, which is that at the end of the day, you've got to get into that partnership space. I think for me, entering any market, whether it's the Middle East, whether it's Africa, whether it's the US, it doesn't really matter. You've got to have the right partners on the ground. You've got to have the right contacts. You've got to have the right people to go into those markets with. Vincent, you had your hand up there. I was going to come to you anyway, because of course one of the key considerations when entering a new market is the legal regulations. And obviously with the UAE, there have been all sorts of things about needing local Emirati partners to set up. Can you demystify that a little bit for us?
Yeah, sure. Well, I'll try anyway. So we often get involved, pretty early on, where clients or organizations are wanting to enter into a new market, and because of the networks that we've got, throughout the UAE and indeed into other countries, where we have worked for long periods of times, we're sort of tapped into, organizations like the Health Authority, private sector, public sector bodies, investors, etc. But we tend to get asked two types of questions: the sort of cultural side of things and then the legal side of things. So if I sort of unpack those in turn, most clients come to us with the desire to enter into the market, but without really a great deal of understanding about what that will entail. And so what we try to do is to walk them through the fact that, what market you're going into, what is the culture within that area, how does the environment differ from what you're used to in the UK, assisting them to undertake or to revisit whatever market research they've done, trying to narrow down what model they're wanting to follow, whether that's, for sometimes they might want to build something or an infrastructure project, create a new hospital or a new clinic, or they might want to white label an existing facility or business, or work in partnership with organizations who are already in country. And each of them comes with different with different solutions and ultimately different processes that need to be followed. Inevitably, the second bit of the question then says, well, how do we do it? Should we enter into the free zones, or do we do something different? So we work with clients to really understand what the differences are between establishing themselves in one of the various free zones versus doing something quite different, and then ultimately working, depending on how they want to do that, setting them up, going through the corporate structuring work. Often they UK clients will be completely unfamiliar with concepts like notarization and getting documents apostolized and that sort of thing. So going through all of that with them is hugely important, but also making sure that they understand that the legal and the regulatory frameworks, they are different, but there are certain similarities. And in countries like the UAE, which has a pretty advanced system of legal regulation in the healthcare space, it's becoming less daunting, I think, for clients to work through that. And now with recent changes in legislation there in terms of the way in which companies can be owned and the percentage of ownership, questions around using in-country agents are still an issue, but becoming less so as more countries actually want to do it themselves. And interestingly, over the last 12, 14 months of the pandemic, because it hasn't been possible in many instances to actually travel and to do that sort of business face to face, many of our clients have found that through the tools of digital networking and through the internet, they've been able to do a lot more themselves without the need for in-country agents. But that doesn't necessarily mean there's no need for agents. So that's a lot of what we tend to get involved in doing.
So, Vincent, just to clarify one particular question, because I know it's been a thorny issue for UK companies going into the region in the past. What are the rules? I think they've changed a little bit recently around shared ownership. What do you still need to have an Emirati partner? What proportion of your equity needs to be shared with a local partner?
Well, that is a good question, and you can have majority owned UK businesses. We've recently set one up for an individual who's within the form, shall we say, in the UAE. There's many factors, and there isn't a one size fits all. And I have to stress that, because it's not easy question to say this model is going to work for every single type of company, for every single type of operator, and for all different types of service provision. There will be differences, and I really think that if you can take anything away from this, getting early stage expert advice on what options exist can save you a lot of time and a lot of money in the long run from exploring things that might not necessarily be appropriate, going down particular rabbit holes that might ultimately prove more time and more cost for you. So getting that advice early on is the best I can say.
Well, I noticed that you've unmuted yourself. Did you want to comment on that point?
Yes, I mean, this is a discussion that I have almost every day, so I can give you a little bit of an insight. I think it really depends on one thing, which is, are you a company that wants to do business in the country only to, for example, do you want to work with a healthcare authority, or are you someone who wants to have a regional business? And because the UAE is a small country, most of them, if not all, would say, we want to start in the UAE or start in Saudi Arabia and then, go to the other countries. And I think the free zone model gives you much more flexibility in compared to the local model. The local DED now, the news is actually very fresh. It was out today, issued by the Ministry of Economy, that starting from 1st of June, they did not say all, most businesses or sectors can be owned 100% by foreigners, which I think really levels the field for everyone, the free zones and the non-free zones or the mainland, and it also puts more pressure on the free zones to not only rely on being a free zone, but doing more than that. Doing more than only being able to have your company owned 100%. So I would say, if you're a company that wants to do local business, that's fine. A lot of companies do that, especially healthcare services. You know, if you're a clinic or a hospital, then it makes a lot of sense. But if you are someone with a technology, for example, and wants to start with the UAE and then expand, I would say free zones would be much, much better.
Really, really helpful piece of insight. And I think it demonstrates again, and having worked in Dubai, I think for about the last sort of 10 years, it just shows once again how much the government of Dubai and how much the Emiratis are welcoming of foreign investment, welcoming of foreign companies that can come in and help to boost their economy. We've got a question on the chat, which I'll come to in a moment, but Mazen's been very patient. He's had his hand up for a while. Mazen, did you want to come in?
Yes, I just want to add to the wonderful points that was brought up by your wonderful panelists. And basically, Dubai, as you mentioned, the UAE, in the last, let's say, 50 years, has completely and drastically transformed itself. My parents came in 1976 from Sudan. It was something different, and now it's changing on regular basis. Hyper legislation, hyper automation, and it's becoming the hub for leadership for this whole region. That's number one. Number two, I want your audience to be mindful of the major events that are coming up in this country. Arab Health is in end of June, Expo 2021. I've been given presentations and talks to the trade missions in my past role in Dubai Health Authority as part of the consultant who worked on the Dubai Health Strategy. And we've been talking to the trade missions, the UK trade missions specifically, on all the great opportunities that this country can offer, not just locally, and not just regionally, but also globally. Again, that's another thing. Keep an eye on those major events that are happening, including this wonderful event that you have been orchestrating. Number three, Dubai and the UAE has masterminded a lot of great legislation in the past 2 years. Something like the UAE Healthcare ICT Data Law is a ground-shaking, healthcare transforming legislation to try and bring health data regulation up to the standards that companies in the UK are used to. And this takes the healthcare industry in a new dimension to try and enable and make it attractive for companies to come in. So partnership is definitely a huge aspect where you can find local partners, regional partners, and get in to feel the water before you actually you commit, if you like. But again, there's a lot of opportunities that are going to be taking place in the upcoming 6 months and beyond as we approach the recovery. We are flying through and igniting the recovery stage at the moment.
I think the point that you raise about events is a really, really good one. I mean, this year would have been, I think, my 9th consecutive Arab Health. It's literally inked in to my diary at the end of January every year. And I often say to people that are asking advice on going anywhere overseas, not just into the Middle East, where they should go, that Arab Health is probably, certainly from a healthcare provider's healthcare services point of view, is probably the event that everybody should go to. I have to say that it should be called Global Health, not necessarily Arab Health, because of the scope of it. I think possibly the one next month is going to be a little bit difficult because of travel restrictions, but certainly for me, I'll be aiming towards the one at the end of January next year, which and Expo as well. So there's a lot going on. I want to get to a question that we've had on the chat, and I want to remind those of you trade mission attendees on the call, just put your hand up if you want to ask a question. I think this probably goes to Marwan and possibly Mazir. The question is from a lady called Marianne Jack-Lamont, who asks, do you think that people needing operations from the Middle East will still choose to come to the UK or other European countries as they've done in the past? Or do you feel or are hoping that people will have their elective surgeries in country rather than traveling? Marwan, do you want to take that?
Yes, of course. I think people used to go for operations that are not available in the country, and as the country's capability is improving and improving, those trips are becoming less necessary. I don't think it's going to stop because the UK, US, and other centers of excellence are still very, knowledgeable. They have very deep knowledge about, certain areas, whether it is, cancer or, other areas. The UAE will still need to build its capabilities. It's still very far from other places. And of course, the government is realizing that sending patients abroad costs a lot of money, because it's not only to pay for the operation, but it's also for their stay, their family, their tickets, etc. So the government is taking that money and investing it in building capabilities, whether it is hospitals, know-how, and even training doctors and nurses. So I think it will continue, but it will reduce by time.
That's a very, very good answer. And I think, Mazin, I know you were involved in putting together some of the strategic work for DHA. And DHA has long harboured the ambition of becoming a medical tourism hub in its own right, hasn't it? What can you say to us about that?
Absolutely. And one of your guest speakers yesterday, Dr. Ebtisam Al-Bastaki, she is leading a huge initiative by Dubai Health Authority, the Dubai Health Investment Strategy. So there are two major strategies that I would like your audience to pay attention to. The healthcare investment strategies, where all the government authorities and ministries are actually establishing investment, an health investment office or some sort of a private-public partnership entity or initiative that would allow some more interaction and collaboration. The other strategy that I also want your audience to pay attention to is the healthcare and wellness, or health and wellness tourism strategy, where there's a lot of investment and direction from leadership in the UAE to invest in centers of excellence locally and bring in the best of breed, or try to build the R&D capabilities in the healthcare, the medical education and research strategy that was launched, for example, in Dubai Health Authority 2 years ago, shows the direction to try and build a more sustainable health system in the UAE. And by the way, the direction is similar to the similar direction in Saudi Arabia, in Qatar, in the region as well, where building local capabilities gives you a more sustainable healthcare ecosystem. So definitely strategies are coming left, right, and center when it comes to building capabilities, building centers of excellence, focusing on oncology, cardiology on one side, medical tourism within the locality of the UAE, as well as building health and wellness capabilities, where you look at for example, mental health, well-being, and how you can cater for a new sector or segment of population where retirees now are getting, residency and prefer localizing their retirement in the UAE. So you're opening up a whole new specialty focus, right? Geriatrics, elderly care, and so on and so forth. So these are the three areas I would like your audience to pay attention to.
I think it's really interesting, actually, because it's certainly in the sort of 10 years that I've been working in the region, the opportunity in healthcare has flipped. You started probably 10 years ago in a situation, as Marwan was describing, where the capability, the specialist capability, wasn't available locally, and the UAE, Saudi, Kuwait, etc., would send lots of patients to London, to the USA, etc., for treatment. Whereas what we're now seeing is that opportunity has flipped round to how can we, as the UK or the US, or as countries looking to export their healthcare expertise, how can we help the region to build its own capability? And the ultimate kind of end of that journey for Dubai, certainly, is this strategy around creating a medical tourism hub for the region locally. And Niti, Vincent, you both want to come in on this, and then we've got a question from Haroon and another question from the audience. So Niti, to you first.
Just a supplementary answer to the fantastic answers we've had already. Just on that, there's a lot of platforms that are now also filtering what needs to go abroad for a second opinion. So I'm working with a platform, for example, called MedStars, that actually has got on its platform tons of tons of folks in the UK, specialists in their very complex areas. So those are very complex conditions that Marwan is speaking about, the very complicated neurological conditions, the very complicated oncology conditions, the cardiology plus the hearts and the lungs that, that takes a long time to develop the capability around. So some of that, I think, is being triaged almost virtually by platforms like MedStars. So getting you to the right place so you're not wandering around the countryside. I mean, I get such a number of calls from my own friends and family who say, I want to see somebody for this esoteric neurological condition. Who should I see? So those are the sorts of things that platforms that we're working with are now starting to triage and navigate. And I suspect that's something that's going to become bigger and bigger as this whole virtual world and digital health services increases. That's the one thing. But you've got fantastic providers now in the Middle East. I know of one that I work with currently. It's Aster Healthcare. They've got hospitals not just in the UAE, but they've also got clinics and they've got labs and the such like. But then also they've got another offshoot in India. So, so it's not just coming to the UK, guys, or coming to there are other places that people end up, Thailand, India, other places where the connections are. So I think it's a truly global world and people will find the best doctor to go to wherever they find the consumer wants to go to. So that was just a supplementary question. And I'm seeing this shift, Steve, as you've said, in all my travels around the world. We're working very closely with companies in Mexico and Brazil who are also starting to look at this whole space, localizing, but also, where do they need to go? How can you get the best opinion in the world from a Hopkins, from a Cleveland, from a Mayo, from the UK? How can you get that virtually first before you go wandering off?
Brilliant. Vincent, do you want to come in quickly before we move on to the next question?
Yeah, I was going to, you could have a whole session, Steve, on medical tourism, but the point I was going to make has Niti's touched on, and I've seen a real shift, not just because of the pandemic, but before that even started, about, what do we mean by medical tourism? And lots of the Harley Street medical area providers were seeing their patient numbers fall. It is a global market, and many of them were looking to set up local referral arrangements, clinical exchanges for both staff and patients. But the rise of the second opinion and the whole digital referral space is huge. And we've worked with a couple of clients and they're doing so at the moment, where that's precisely what they're doing. They're creating hospitals without walls through clinical networks that refer patients to specialist doctors, physicians, consultants from all around the world to enable the patient to get those second opinions, to get those insights without having the patient traipse around the world to see people. And with the ability to do much more remotely through remote diagnostics and other tech environments enables that to happen. And I suspect that will continue to grow and grow, and you'll see less people going in the old, what I would call the traditional concierge package of the patient and their family going through getting flights, accommodation, leisure activities, and all of that side of things. I think we'll see that diminish.
Thanks, Vincent. Haroon, you have a question?
Yeah, just a comment around the medical tourism. I'm glad it's the digital side's coming in, because the key problems we've seen when we've looked at different projects looking at medical tourism is continuity of care and having the records matching. You don't know if the patient's gone to Memorial Hospital and they've had X and then gone to Thailand and they've gone to Bangkok. I think the digital space will really clear up that continuity of care issue and have the records of what's happened to the patient. So I think that's fantastic. The question I had was more for Mazen. You mentioned that there's a new bit of legislation coming in governing data, something that's, of course, my area of interest. How does that impact how data is used? Because we're sort of a small boutique agency who work on particular specialist data science, machine learning type projects. And there's sometimes an issue we've had, particularly in the pandemic, is we need to have an in-country presence every time someone is processing any data. They have to be on the ground within the country to be able to access. Whereas when we work with other countries, we're able to VPN in and use the legislation and use the cloud a bit more and those sorts of things in non-healthcare areas and healthcare areas. how is that new legislation going to impact the way we do our work selfishly?
For sure. So I think there are already, if you type in the healthcare ICT data law, the UAE federal law, it came out already. There is more, I would say more modification and expansion on that legislation. It came out in 2019. I had the pleasure to work with Dr. Usama Al Hassan, who unfortunately wasn't able to join us today due to not feeling well, in being in a committee, a national committee that worked on putting together the ICT, the healthcare ICT data law. Again, there's a lot of great content out there. More than happy to connect with you on my LinkedIn, which I put in the chat. But what you will see that, for example, localization, data should not cross borders. That's number one, unless, and there is now more modification, more expansion on it, unless it's anonymized. So there will be some expansion to try and allow data to cross borders based on the control factors that the government will put and the benchmark that they've put together for the use of data, secondary use of data and whatnot. For example, I work with IQVIA. IQVIA is a human data science company where we do a lot of data with pharma and whatnot. And we are very well versed with the data requirements, for example, of the land, based on the ICT health data law. For now, there is a lot more expansion that would come to the articles of that legislation that would give more guidance on what sort of allowance and how can you actually consent for data and how the data should be stored. There is already features of the law that is available and you can read about it. Again, the gist of it is to keep the data within the local borders. However, there might be an expansion, or there should be an expansion, or will be an expansion very soon to see how we can actually anonymize data and what sort of allowance that the government will give in order to take the data broad. This is maybe the gist of it, if I may give you. And I can expand on it if you like, if you want to get in touch.
Thanks for that, Mazen. So we have a question again in the chat, which I think is probably something close to the hearts of all of our panelists. Anthony Phillips asks, how vibrant is the investment community in the UAE in healthcare and wellness, and what's the best way to access funds? Well, I think our investment expert is Niti. So Niti, I'll go to you first on that one. How easy is it to access investment in the Middle East?
Well, you've got to know the right people, and also got to know what I find is, let me start again. What I find is a lot of startups, a lot of companies are trying to access capital, don't actually target, what kind of capital they're looking for. So are they looking for debt? Are they looking for equity? Are they looking for a venture capital partner, a private equity, or a family fund? What stage of your development you're in? Are you pre-Series A? Are you to seed funding? Are you looking to bootstrap? Where are you in your revenue cycle? So there's a whole bunch of questions that comes up when somebody approaches me, and I will ask those questions. So there's a vibrant investment community, and I'm sure Marwan can tell you more about that. Very vibrant investment community in the UAE, in the Kingdom of Saudi Arabia, in Jordan, actually. Very, very vibrant, a very big fund based out of Jordan that we're partners with. So there are many funds that are there, but it's actually trying to access the right kind of capital and getting the advice on the right kind of capital that you want to do. If you've already got revenue and you've got contracts, and you may not want to you might not want to give away part of your company. You might want to raise debt. And that's also a possibility in countries like the UAE. Obviously, it's subject to Sharia law, to obviously not, you can't just raise just like that debt. So I think it's really important to understand that. But there is a very vibrant investment community. There are also the family funds, lots of family funds and lots of sovereign wealth funds as well, like Mubadala Healthcare. But you really do need to know what kind of things they're investing in. What is it that's driving them? What's their investment strategy for the future? Is it long-term, medium-term? So it's not just a question of just going out there saying, I want the money. It's all of those questions that you need to answer. At Harbour, we have a very vibrant community of LPs that we work with, about 60 of them. And some it doesn't need to be in the Middle East. There are people that are investing in the Middle East from funds that are outside of the Middle East as well.
Great answer, Niti. Marwan, you said that as part of the Dubai Science Park service, you can help people connect to investors. How do you go about doing that?
I mean, again, it really depends on many things, like Niti said, and I think you provided a good background on that. What's interesting is that there is a shift also in investment, whereas about 10 years ago it was more in the brick and mortar, building more capabilities, clinics and hospitals, and now they've realized that they want to improve the efficiencies of their hospitals and their services, for example. So there's a big drive into the areas of digital health, for example. So it's a very, very interesting times. I think the likes of Mubadala, Adia, PIF, they will do the big ticket items. So I would say for startups to stay away from them, because a $10 or $20 million for them is too small. But there are so many family offices, I would say, that do single digit kind of investment, and there's a lot. I mean, even for me, it's hard to keep up, to be honest, because it's not only in the UAE. You would find a lot of people from Saudi, from Jordan, wanting to invest in a company that starts from the UAE, because they know that UAE is always very receptive to innovation, to doing things differently, to improving things, and especially the government, if they like something that would make a big change, they would also support it from their end. So it's definitely a vibrant area, but it really depends on where you are in your life cycle, and also what kind of product do you have.
I think it's always interesting, isn't it? Because investment is in a lot of ways about a lot more than just money.
Yes.
Certainly, it's about also finding partners who will support your growth, not just financially, but with their contacts, with their knowledge of the system. Vincent, you must see a lot of UK companies that are looking to work in the Middle East and looking for investment specifically for that purpose. What kind of advice do you offer to those kind of guys?
It's really similar to what Niti said earlier. I think ultimately going into the market with an understanding of what you're trying to achieve and who can help you is hugely important, because in the past, I think people have just sort of taken the view that, well, it's a very affluent place, isn't it? And if I go over there, I'm sure to find somebody who will give me some money or who will support me. And it's, if I go to, to the Arab Health Conference, I'm sure to do business. But when you're sat at the other side of the table and you see that these funds and and people from the health authority, they could have 30 or 40 or 50 meetings put into their diary in the course of 2 or 3 days of Arab Health. I don't really think that's the way to do it. I think the way to do it is to start early, make the connections, speak to the experts who know where the money is and what would be best for you, because you can waste a lot of time of your own and actually waste a lot of other people's time by going to them and saying, well, this is what I want to do and this is how much money I need. But if their lending criteria is completely unknown to you, or if their investment criteria is completely unknown to you, you're wasting your time, you're wasting their time. So we regularly try to facilitate introductions through to investment houses, PE houses, sovereign wealth funds, etc., for the clients that we work with, because we understand what the client's business is, and we understand who they can best speak to, and it's facilitating those introductions. But you're right, Steve, it's about more than just money, and it's about finding partners who can actually help your business better or in a more rounded, holistic way. And ultimately, that I think is something that a lot of clients come to us for, because we have worked for so long in the Middle East, and we have so many clients who are already over there that actually those clients become springboards for new clients entering in the market, who can introduce them to the right people on the ground and who can help them get their businesses established.
Absolutely. I think that whole point, sorry, Niti, I'll come to you in a second.
On the strategic investors. So we have a lot of relations with strategic investors as well, but you need to know what their strategy is, right?
Yeah.
So you can't just what just that, as Vincent said, but it works both ways as well. So the other thing that I have found over the years is it's not a one-way corridor. It's a two-way corridor. So you also have clients I also have clients in the Middle East who also want to do similar things, maybe in the West or in India or in China. We have a rep office, for example, in China. So it's a two-way street that's happening. And then just quickly on the back of what Marwan said about, the places people, and Mazen said on where people are investing, biotechnology is becoming really big in terms of the very smart biotechnology on the back of testing and tracing. So all the technologies that have been developed, we're seeing a big growth in those areas. And it's also something that the investors I work with can get their arms around. It's not jam tomorrow. They're looking at something that's very tangible that they can hold in their hand, a microchip or something like that. So it's something that people are starting to invest much more in.
Thanks, Nitty. So yeah, I think the other thing, the key thing that I wanted to draw out from what Vincent said was that point about getting in touch with people that have done it already, and getting into partnership with people that have done it already. If you can create relationships with organisations that are already working in the region, they've got a pretty good idea of how their journey works and how they got there. So it's a great way in to kind of understand companies that are already there. The other thing that I would echo is that point about getting in touch with the right experts early, and I would say that my four panelists today are some of the right experts. So get in touch with them early. We've got 5 minutes left. So what I want to do is just whip around the panel very quickly. You've got 1 minute each. Can you give me, please, in 1 minute or less, your one single biggest tip for any company looking to enter the Middle East market? I'm going to start with Mazen because he's got his hand up. You've got 1 minute, Mazen.
Absolutely. Patience, perseverance, and relationships. My LinkedIn is in the chat. Please connect with all these wonderful scholars and panelists that you have. It's all about connections. Thank you.
Nitty.
Sorry, I was on mute, talking to myself as usual. My biggest, connections are very important, is what Mazen, you took the words out of my mouth, and relationships. I think it's understanding what kind of capital you want to access and the market you want to access. Middle East is a big area as well. It's not just one country. There's lots of different countries there. Just decide where you want to be and who you want to access, and then go for it.
Vincent, do you want to come in next?
Yes, and you might say a lawyer would say this, but I think for me, it's about taking advice early. Don't wait until you think you have nailed all the answers and then take the advice, because you might find that actually we grit through teeth and I wouldn't have started from here type conversation. So take that advice early. Understand the market that you're going into, select your partners carefully, do the diligence that you would normally do when you're doing business here in the UK. Understand the practice and customs will differ. The way that business is done in the UK and London is not the same as it is done in the Middle East. Other softer things, be aware of yourself. Body language is just as important in other cultures as is the spoken word. Understand how your hosts expect you to behave and how you should communicate. So really know your host when you get there. Those are the sort of things that I'm always discussing with clients.
Thanks, Vincent. One last word to the man on the ground.
Well, obviously everything that my fellow panelists have said, but to me, being someone who meets with a lot of companies, especially those who are new to the market, a lot of them come without doing their homework. So I would say, do your homework, see who's doing something similar, find your niche, find your competitive edge, and then, from there, basically, set up your company. Obviously, look at both options, free zone or non-free zone, and everything that everyone has said. It's definitely people I think need to understand that, especially for Dubai, it's a country where we have so many tourists and visitors. So people have heard a lot of things. So, but it's important to select how to start and who to do it with. It's very important.
Thank you very much to Marwan there and to all of my panelists. I think the key takeaways from me, number one, I would say that any organisation that wants to enter the healthcare market in the UAE and the Middle East could do a lot worse than to watch this session back. I think my panel have been fantastic. I think that the key takeaways, partnership, and more partnership. Talk, communicate, understand what the need and the requirement for the product or service you're bringing into the region is, and find the advocates, the companies that have been there before, the people that are involved. There's great advice out there for anybody looking to enter these markets. Dubai Health Authority are a fantastic organisation to work with. Dubai Science Park, the British companies, the UK Embassy in Dubai are guys that I've worked with extensively in the past, and Klaus Peter Rees there is a very, very good resource if you can get hold of him. And yeah, as Vincent said, get the right advice. Vincent's a great guy to go to for that. Get the right advice early, get it often. And Vincent, Nitty, Marwan, Mazin, all of them are people that I've known for a while. They're very, very good people who know what they're talking about. So talk to them and their ilk. It's been fantastic. It's been a great session. Really, really enjoyed it. If you do want to watch it back, it will be available on the website immediately after this session. We've got another great session this afternoon on working with development banks, particularly with the World Bank on aid-funded projects. That's on at 4 o'clock this afternoon. Tomorrow morning, we have a session on the South African health economy and how to do market entry there. And finally, tomorrow, we end with the amazing Anishka Kavali, a very good friend of Nitty's, who will be chairing a panel on the future of healthcare in Africa. Only remains to say again, thank you, Nitty, thank you, Mazin, thank you, Marwan, thank you, Vincent. I've been Steve Gardner. I'm the MD of Healthcare World. Read the magazine, use the website. We'll see you again very soon. Thank you very much. Goodbye.
Goodbye. Thank you.
Thank you.